Fluoxetine is a common medication used for disorders like depressive disorder, OCD, bulimia, panic disorder, bipolar, anorexia, ADHD, diabetic neuropathy, and obesity. And it's most often used with issues like ADHD, OCD, and depressive disorder. The trade name for fluoxetine is Prozac. Its therapeutic class is antidepressant, and its pharmacologic class is SSRI, or selective serotonin reuptake inhibitor. Okay, so what happens here? What it's really doing is, in our neural pathways, we have synaptic clefts, right? And serotonin will go into this space and then try to go, on as a neurotransmitter. What these SSRIs do is they inhibit that serotonin from being taken back in. Okay, so it allows for more serotonin to reside in that synaptic cleft, and serotonin's thought to play a role in mood. Okay, so if we have more serotonin available, it should affect the mood and it should help the patient feel less depressed, be able to control their ADHD and be able to control their OCD. So this medication, like we said, is fluoxetine or Prozac. Some of the things to keep in mind here, and with a lot of these antidepressants, it's really important that the patient is not taking one class of antidepressant with MAOIs, or monoamine oxidase inhibitors. So what really needs to happen is there needs to be about a 2-week gap between stopping one and starting the other to make sure that it completely leaves the system. These SSRIs can actually also cause suicidal thoughts, drowsiness, anxiety, sexual dysfunction, insomnia, and palpitations. Because of these side effects, a lot of patients that begin taking these medications stop taking them. They don't like feeling these drowsiness, this anxiety, the sexual dysfunction, the insomnia. They would almost rather deal with the depressive disorder, or the OCD, or whatever it is, rather than have to deal with all of these side effects. We'd also want to be very closely watching our patients because fluoxetine can lead to a QT prolongation. And when we're talking about that, we're talking about our EKG. We have our PQRST and our EKG. SSRIs can actually lead to a QT prolongation. And what that's really doing is it's elongating our ventricular contraction, which could then lead to ventricular arrhythmias, okay? We want to really monitor our patient and assess for any sort of suicidal ideation. We want to monitor nutritional status, and we want to inspect the patient, make sure that the medication is working for them. We really want to see if they're taking it. We want to instruct them to take it as prescribed and to make sure that they're using the medication, that it's actually working for them. Okay, with a lot of patients who start antidepressants, we have to adjust the medications to find something that really works for them. So it's really important that we watch them and that we monitor them and we make sure it's actually working. So that is fluoxetine or Prozac. Its pharmacologic class is SSRI, or selective serotonin reuptake.
This has been another episode of the Nursing.com MedMaster podcast. My name is John Haas, RN, CCRN alumnus, and I want to give you our free download of the 50 most commonly prescribed medications. To get that free download, just go to nursing.com/50meds. That's 50, nursing.com/50meds. We love you guys. We want you to succeed. That's why we provide clear, concise, and visual supplement for nursing school and the clinical floor. We love you guys. Go out and be your best selves. Happy nursing.